Hey.
Hey.
Morning, folks. I'm just going to get started in a minute. We're just waiting for more people.
Okay.
Leslie, can you hear me?
Yes, I can.
Leslie, sorry, I can't hear. Hold on. Let me see if I can hear you.
I can hear you. Brittany, can you hear me?
I can hear you, yeah.
Okay, good.
Michael, did you see the one I sent you yesterday with the new cover page? Can't hear you. Leslie, can you hear Michael?
No.
Can you hear me now?
Yep.
Yes.
Okay. Good morning, Akila.
Morning, Michael.
So we're just waiting for a few minutes to get started. There are, how many people are in the room? There are 16 people currently in the, who are watching this right now. We're going to wait till we get to about 35, 40. For everyone who's already joined us, if you want to comment, the chat box should be open. And if you want to tell us a little bit about what you're hoping to learn today, we can make sure if we have a particular point in our data that we that will come up, we'll make sure to cover it. So if you could, the chat should be open.
Michael, you can just give me the cue when you want to get started.
Oh. We'll wait 30 more seconds and we'll get started, Akila.
Nice to see you, Leslie.
See you as well.
Thanks for all of the wonderful work you and Polaro are doing.
It's a great project. So interesting. I love it.
All right, Akila, if you want to kick us off.
Great. Thank you, Michael. Welcome to everyone that's joining us today. My name is Akila Peoples. I'm CEO at Mental Health Research Canada, and very, very pleased that you've joined us today. I know we have participants from across the country, at least 9 provinces, and we're very, very pleased that the information from our polling work has attracted so much interest and is being put to such great use across the country. If you haven't already done so, you might want to check out our portal that houses a lot of this data from all of our past polls. It's very easy to use. I heard great feedback on it as recently as this morning on how user-friendly it is. It's easily searchable by age, gender, region, and poll. That's not all of the polling data that we have. The rest of the information can be accessed by connecting with Michael. All of the information is free. When we embarked on this important work early in COVID, we wanted to make sure that we were providing timely and relevant data that could be useful to stakeholders across the country to inform the path forward through COVID and hopefully COVID recovery. So we're very pleased that so many of you are interested in using this important data. I do want to just give a shout out to our funding support from Health Canada. We are doing this work well into 2022, 12 polls in total. And I also want to give a thank you to my colleague, Michael Cooper, who is a strategic lead on this important work. And he does a tremendous job making sure that it is maximizing its efforts in informing stakeholders across the country and providing useful data. So I look forward to perhaps seeing you on our next polling webinar, or perhaps on our Spotlight on Research webinar, which is tomorrow. We have one of those once a month to highlight our co-funded research projects that we work on with various partners across the country. So thank you very much again for joining us, and over to you, Michael.
Great, thanks, Akila. So thank you for the comments so far about the chats. If you have specific questions, Brittany or I will be monitoring the chat to see if there's specific questions. Brittany, by all means, if there's a burning question, interrupt me at any point. And like many of you, I'm working from home. So if little ones run by, my apologies in advance. I'm sure everyone understands. So as Akila mentioned, this is the 6th report we've issued around the state of mental health during the pandemic. We started our work in April 2020 and have been polling at approximately 2-month intervals since then. And the data we're going to talk about today is from approximately April 20th to the 27th, although a lot of that was captured by the 25th. So just to give you a sense of that, it's about a month ago. And I think that's a pretty short delay. We're pretty proud of the fact that thanks to the great work of Leslie and Polera and some of the other analysts that we work with, we're able to extract data relatively quickly and get it to the market. As Akila mentioned, there will be, we have a data portal which allows people to search by province, by age, and by gender. And the polls, it also is sortable by poll number, starting with poll 2. So polls 2, 3, 4, and 5 are currently up, and poll 6 will be up imminently, and you can aggregate the data how you see fit. So this is the the sample we did on the poll 6 was 4,005 Canadians, which included a representative sample of 3,000 nationally, and then 2 additional up samples in our provincial partners. The provincial partners that participated in this last round were Newfoundland and New Brunswick, if I'm remembering correctly, and we'll be also partnering with additional provinces for poll 7 in terms of doing an additional up sample. So the major highlights I just want to talk about quickly. The self-rated anxiety in terms of those who rated 8 to 10 on our scale was 28% of Canadians, which is the highest we had seen yet. And 17% indicated a high level of depression. Again, the depression number was flat from the previous poll, but where we did see movement was primarily in Ontario, where 1 in 3, 33% indicated high anxiety, and 1 in 5 indicated high depression. This is typical. What we often see is it's not typically around case counts that drive up anxiety and depression. It tends to be closerly more aligned with lockdowns. So we see that in our data, and it's been pretty consistent through the start of the poll. I would add that we still have the pre-numbers in terms of how many people would rate high anxiety and depression prior to COVID. And prior to COVID, it's about 5 to 7% of the population indicated high anxiety to about 28% now. So it's anywhere from 4 to 5 times the higher degrees of anxiety, and depression's up about 3 to 4 times from where it was pre-pandemic. We also do track by a number of demographic factors, and some of the groups that we consistently and have seen throughout the entire project have seen highest rate of self-rated anxiety and depression. Younger Canadians, especially those 18 to 24 or 25 to 34. We also see it specifically in people who have children at home. We see it primarily in people who are living alone or with roommates, and we see it significantly with frontline healthcare workers. It's not in this report, but we're working on a separate data report with the Canadian Nurses Association, which indicate that most of the drivers of frontline healthcare workers in terms of high anxiety and depression are nurses, which are significantly higher than other frontline healthcare workers as well. So we also, of course, in this test have the Kessler 10, the general distress test, the PHQ-9, which is a screener for depression, and the GAD-7, which is a screener for anxiety. Fascinating for us when we ran these tests is that we actually saw more predominance of youth. We thought we already were commenting that youth were significantly more affected by the pandemic, but when we ran the screeners, the clinical screeners on them, we actually found that, especially around the anxiety, those aged 18 to 34 were 3 times more likely to have a rate as severe on the GAD-7 screener. We also looked at the Sheehan Disability Scale, which indicated that 30% of Canadians indicate that their mental health is having an impact on their ability to function, with the greatest impact on social and family life. Of those who are working, about 8% indicated they're losing days, like taking days off, as a result of mental health, and 30% indicated that of those working or in school, their productivity was decreased. The good news is the resiliency scales still indicate that a large percentage of Canadians are resilient. So we see this divergence between a group of individuals who are affected and a group of Canadians who remain highly resilient to some of the challenges of COVID-19. And of course, the other good news is that people are expecting their mental health to improve, with a full 10% less Canadians, or 28 to 18%, indicating that when in 2 more months or a month from now, they expect their mental health to improve. Due to a combination of factors, be it reduction in lockdowns, summer, increased vaccination efforts. The one thing I did note was that the number of people who indicated that they expect to be depressed a month from now or 2 months from when we did this didn't actually move at all. So those people who are depressed are indicating that they don't think their mental health is going to move significantly. We did, of course, track activities people are doing, and going outside, walking and hiking continues to be the most positive thing you can do to support your mental health. Surprising for me, of course, was that this remained high during the winter as well, too. And it's just continued to rise. So while some things, especially social media, daily news, continue to be more of a negative impact, going outside just continues to be a positive impact. So we always encourage Canadians to spend as much time outside as they can safely, under whatever rules and guidelines they are following. We did also, for the first time, do a 1 year to 1 year comparison of people accessing services in the year before COVID and then the year of COVID. So basically, we're talking April 2019 to April 2020 against April 2020 to April 2021. So 1 year before, 1 year of. And we did find that the number of people accessing services went from 11% in the year before COVID to 18% in the first year of COVID. I can see Leslie just doing the math in her head. But yeah, and the other thing we of course tracked was whether people were satisfied with their service, and why they weren't. We asked them if they felt they should have been accessing services, why did they not access service? And the one thing that changed dramatically during the pandemic was the cost of service went down. The reason I wasn't accessing services was because of the cost went down dramatically, indicating an increase in the number of people who were aware of free resources or low cost resources that they were accessing. So those are the major findings. I'll get into the charts in a second. I'm just going to ask Brittany if there's any comments at this point.
Nothing yet, Michael.
Okay, great. Thank you. So going ahead, and this is on our website, so please understand that on a 47 slide deck, I'm going to move pretty fast through some of this fantastic text and copy, which very smart people wrote. The one thing I wanted to highlight here was the we do have a lot of that I just covered right in our discussion. The one thing that we'll get to a little bit later is suicide ideation, which we've seen rising as well too. And then a lot of this we'll just get to in the charts here. So you can read this afterwards if you're interested. I would add, we did ask about alcohol consumption again in this poll. We'd taken a break on those questions, and we did ask again. And again, we noted that alcohol consumption, while elevated since the start of the pandemic, has not been moving significantly during the pandemic. Another thing we asked as well is people's concerns around a post-COVID world, or do you think you'll be concerned about COVID once vaccination levels get high? And a number of Canadians did indicate, a large majority indicated that they will remain concerned about COVID-19 once we all return to a more regular life. So this would be the scales in terms of, do you have a diagnosed mental health? Do you have a diagnosis of a mental health affliction? And it was said 17% indicated that they had an anxiety disorder pre, and 5% said they got one since. And you can see the numbers. We also asked if a family member had, and the reason we asked that is to understand if people have a familiarity with the mental health care system. That's a very high number of people who have indicated they've got a diagnosis since COVID. When we look at the year before, when they got the diagnosis, and the year of, we have seen a significant increase in the number of people who are indicating their diagnosis. Who is most likely to get a diagnosis? Females, younger and middle-aged Canadians. Interestingly enough, employed Canadians indicated that they're more likely to get a diagnosis. Although the question, of course, here would become, does access to benefits or an EAP program drive up the rates of diagnosis? And we have seen some evidence of that. Particularly surprising is 30% of frontline healthcare workers, and again, that's primarily driven by nurses, have indicated an increase in their diagnosis of anxiety and depression, actually, as well. Again, we see that the most common ways that people are managing their mental health challenges are with prescription medication. We always, of course, talk about the importance of talk therapies, which are the second and third most common ways of managing mental health challenges. I would add that these are not exclusive categories, so you can click multiple ones here, but this does indicate that there's a large degree of people who have a mental health diagnosis who are primarily managing it with medication. This was an interesting question we asked: who has been the most supportive of you? And this is just for individuals who had a mental health diagnosis. And you can see that family and friend supports are dramatically more helpful for those who have mental health diagnoses than professional supports. This is the chart that indicates the level of anxiety pre and post COVID, and depression pre and post COVID. So you can see this is where we get that 28% statistic, and the 6% who indicated that that they are if their anxiety was high pre-COVID. Again, as I indicated, this is anywhere from 5 to 7% pre-COVID, and it's just continued to rise from 20% when we did this first in poll 1, which would be April 2020, all the way till today, which is 28%. Again, what groups are the most likely to indicate high anxiety? It's not dramatically different from those who are indicating an anxiety disorder. One thing we thought was fascinating was if they were familiar with the Wellness Together program, Wellness Together Canada program, that they were more likely, there was a number of people with high anxiety who were accessing that platform, which is good. This is a fascinating one for me always. We consistently see Quebec as having lower levels of self-rated anxiety and depression, which is interesting for me because throughout the entire pandemic, when they've had significantly higher case counts, those numbers didn't budge. So it tends to, as I said, to move more with lockdowns. And you can see, for example, in Alberta, which at the time we ran this was having astronomically high case counts, had a relatively low level of anxiety at 24% and 12% depression. While Ontario, which was in the midst about 2 weeks into one, if I recall correctly from my timelines, had 33% of people indicating high anxiety and 21% indicating high depression. This is the Kessler psychological distress scale. So this indicates whether people, this is not a diagnostic tool. It indicates the level of distress people are feeling. And we do indicate that about 58% of people have a moderate to severe mental disorder based on this criteria, with the most likely, the most common symptoms, and these have not moved through the pandemic, being tired out for no good reason. We often correlate that with burnout. One thing we wanted to highlight for the first time was that just because we're talking about anxiety disorders and depressive disorders doesn't mean that we think those are the only impacts that are going to matter. Another significant one is post-traumatic stress disorder, which we've been hearing a lot about. And so we wanted to just highlight the fact that post-traumatic stress disorder can manifest itself months after the trauma. And there is not a tremendous amount of data about how to actually assess it on a population-wide level. But we wanted to just highlight a few of those things here in the report. This is the GAD-7, the anxiety screener. So again, 6% were likely to have a severe anxiety disorder. It was significantly more prominent among those who are younger, 18 to 34, versus those who are 55 plus. And you can see that the symptoms that they're most likely demonstrating being easily annoyed and irritable. This is the PHQ-9 or the depressive screener, which indicated again, 5% were likely to have a severe depressive disorder. And again, it's looking like burnout is primarily the feeling tired or having little energy. Again, far more prominent among young Canadians. We did run some correlative analysis on those, by the way, to understand how they all correlated to one another. We did find that the self-rated scales were the most correlated at 0.92 to the Kessler psychological distress scales, which makes sense because that is less of a clinical screener test and more of understanding what people are experiencing. So, it makes sense to us that if someone's feeling that way, then their self-rated scales would be similar. And again, this was the question of self-rated, where do you think your mental health is going to be in 2 months? Again, it was 28% today. People, 18% think their mental health or their anxiety will be high in 2 months. Broken down by province, not a huge amount of difference here in variation, although Alberta and Quebec noticeably considerably lower. We also ask how people are managing their stress through the pandemic. It has not dramatically changed. Brittany, I'm going to throw it over to you here for the impacts on mental health.
Sure, thank you, Michael. So before I say anything, I want to apologize in advance if there is any noise coming from my end. They are doing a lot of construction outside my window today. One of the other joys of working from home. Et pour ceux qui sont francophones, bienvenue et merci d'être venu aujourd'hui. So also I want to say, Michael and Leslie, if you feel like I'm skimming over anything, feel free to jump in at any time. So on to the next slide, Michael, if you don't mind. So for this poll, we wanted to take the opportunity to understand not only the severity and frequency of symptoms of mental health challenges, but also the impact they're having on the daily lives of Canadians. So the Sheehan Disability Scale allows us to look at a loss of productivity and ability to function in the work and school life and also in social life. So on the left, we are looking at, we're seeing that 30% of Canadians are reporting that their ability to function on a day-to-day basis has been affected by mental health challenges, which is quite significant. So of that 30%, we're also seeing that the social life and leisure activities are facing the most disruptions due to mental health challenges as well, with 42% rating it as being markedly or extremely affected. Again, we're seeing more of a negative impact on women in that 18 to 34 age group. Michael, unless you have anything to add, keep going. So here we wanted to find out if mental health challenges were causing Canadians to lose work or school days. We filtered down to Canadians who are currently employed or in school, bringing it to a base of about 2,500 respondents, of which 8% said that they were in fact losing days of school or work because of mental health impacts. And this isn't just a day here or there, it's actually averages about 2.7 days within a week. So the percentage also increases when we look at healthcare workers, which is showing about 13% having lost an average of 2.6 days in a week. You can keep going, Michael. So finally, in terms of productivity, we were able to look at the percentage of Canadians who were, when they were able to go to the workplace or to school, who were still losing productivity or the ability to function. So 30% of these respondents had said that their productivity at work or school had been impacted within a week, and that was about 2.9 days within a week. For me, an interesting point here is that while women show to be more prone to having reduced productivity than men due to mental health impacts, men were showing to have longer periods of this in a week, at 10% feeling reduced productivity for a full 6 or 7 days. Versus 5% of women who were showing kind of the same length of impact to their productivity. So this one I'm actually going to throw back to Michael if you want to jump in on this.
Sure. So, we are cognizant of the fact that suicide ideation questions very sensitive. So we were careful in adding this question, and we did ask whether or not people were thinking about suicide. We had 7% of people who indicated that they were thought about suicide in the last 3 months, and then 8% who thought about it in the last year. But because they could choose multiple options, when we put those together, it was 12% of Canadians indicated they had thought about suicide in the past year. And just we wanted to make sure that we were consistent with other findings, since this was the first time we asked this question. And we did find that the Canadian Mental Health Association put out something on this in a similar range, as did the Mental Health Commission of Canada, has been commenting on this, and their numbers are very much aligned with ours. So this is, very challenging. I think the part that stood out for me the most was that 19% of 18 to 34-year-olds had thought about suicide in the past year, which includes 11% in the past 3 months. And of course, we've seen some recent numbers come out from the Code Pink campaign indicate that suicide attempts among youth who are below the age of 18 has doubled since the pandemic. And furthermore, our numbers seem to indicate that the suicide ideation was about 2.5% pre-pandemic. So this is something that we intend to watch through the rest. It's a very sensitive topic. And certainly we will commit to trying to track it through. If anyone has any questions on this, we are certainly willing to entertain them. Next slide.
Yes, please. Thank you. We actually go on to the next one because we're gonna look at the charts. Thank you. So as Michael mentioned, social isolation is showing to be the leading stressor on mental health among Canadians. With an 11% increase from our first poll, we're now seeing that 52% of Canadians are reporting social isolation being apart from others as a leading stressor on their mental health. Possibility of catching or a family member catching COVID-19 are also among the top stressors here. Staying relatively stable, but increasing by a percentage or two since the last poll. Communicating with people outside of your household seems to be taking a bit of a positive turn in this poll, as well as interacting with members of your household. It's hard to say why this is. It could be, seeing the light at the end of the tunnel. I'm sure there's a ton of factors, but you being able to start making plans and thinking about the future, I'm sure is having a bit of a significant impact on that.
One thing I want to just add here is that we did see a significant negative movement on a lot of these activities in poll 2, but you will see it consistently clawing back towards what was when we asked in poll 1, what is the positive impact of communicating with families and friends outside your home? 40% said it was positive, and then it dropped down to 18%. When we looked at this again in August of 2020, and it started to claw its back. So that's an interesting trend we're following as well. I'll move on.
So the economic downturn is continuing to have a negative impact on mental health, particularly for younger Canadians. Generally, it's holding pretty steady at 44% of Canadians feeling that it is negatively affecting their mental health. Working from home is a new challenge for a lot of Canadians that is continuing to be a challenge for people. It's we've had a 3% increase from our last poll 5, and those who responded that it was having a negative impact. The one thing that has kind of improved a little bit is that the negative impacts of those with recent job loss seems to be improving slightly. So that's something to be aware of. So that's all I had for economic downturn in terms of those points. But here we wanted to capture the ways that certain activities are impacting mental health. So though we saw major dips in the effectiveness of these activities between polls 2 and 4, we are now starting to see an increase in their positive impacts. So going outside for a walk or a hike, or just getting a little bit of fresh air continues to have the most positive impact on Canadians. Now at 40% or 47% of people, saying that it is having a positive impact. And the changing seasons could be one of the things that's really impacting this. More people, of course, want to go outside when the weather's warm. Another thing that hasn't changed is the daily news about COVID-19 is having an extremely negative impact on the mental health of Canadians, and then that has increased 5% to 50% of respondents saying that it is either somewhat negative or very negative on their mental health. So as far as alcohol and cannabis consumption, there hasn't shown much of an increase, as Michael said, in either since poll 1, with 28% of Canadians reporting that they have increased their alcohol consumption since the beginning of the pandemic, and 33% consuming more cannabis. A notable change in poll 6, I suppose, is that there has been a 4% increase in Canadians who've responded that their alcohol consumption has actually decreased since the beginning of the pandemic. And another thing to note is that it is Canadians in that 18 to 34 age group that are reporting that their alcohol and cannabis consumption has increased. More so than others, of course. Other age groups are as well. So this is a positive one. We like this one. So this is an indication of where Canadians' mental health recovery could be in terms of whether they think that they'll be able to bounce back from mental health challenges. So it had been holding pretty steady between polls 2 and 5 at between 60 and 65%, feeling very confident about their ability to bounce back. This poll is showing us it's actually increased to 69%. So this is a great sign as we move forward towards and into the recovery period. An interesting point here is that Canadians in the 55 plus age group are feeling more resilient at 80%, feeling very confident that they will be able to bounce back, where younger Canadians between 18 and 34 are feeling a little bit less confident at 57%.
Just to add there as well, I'm also fascinated by the bullet that indicates that that those who have got a diagnosis are not feeling as resilient as well as a group we need to continue monitoring.
Okay, and finally for my little area, we had the opportunity to look at different factors of vaccination with vaccine rollout progressing throughout the country. So one thing that we were able to look at was vaccine hesitancy among Canadians. And though it looks on this kind of graph that Canadians planning on getting the vaccine has decreased by 6%, that's actually not the case, because it doesn't take into account the people that have already been vaccinated. So that's certainly something to note. So it's probably holding quite steady, would you say, Michael, around the same, like 77% of people who will get vaccinated?
I mean, if you do the math, we're actually slightly above. There's about 70% who are either vaccinated or intending to get it right away. And it's when you factor those who are happy about the prospect of vaccine, we're actually over 80%, which is consistent with Leger and on other Ipsos and a number of other organizations tracking this, that vaccine hesitancy, the most against it are about 6 to 9%. There's about 70% who are super excited, and the rest are in the middle, with more who are planning on getting it but a little skeptical. but this bodes well. What I wanted to add on this one, and we didn't make it more of a feature of our report because we finished it close to the end of this report, was we did do an analysis on those aged 55 plus who were vaccinated against those who are not vaccinated. We couldn't do a full vaccinated versus unvaccinated analysis because of the demographics of who was vaccinated and the massive differences we see by age. And knowing that young people are reporting higher anxiety, we didn't want to do a vaccinated against an unvaccinated with such different demographics in the two groups. When we did run a 55 plus analysis of just that age group, we did see that a significant number of people who are unvaccinated are also showing much higher on the depressive scales. So the people who are vaccinated are much lower on the depressive scales. The people who are unvaccinated are much higher on the depressive scales. And this sort of harkens back to, I think it was poll 3 or 4, where we looked in a deep dive into people who were not following COVID-19 regulations or who indicated that they were not following COVID-19 regulations. And I think we did find back then a significant number of them that were indicating higher levels of depression. And I always get the question, like, do we think that not following the guidelines or not getting vaccinated is driving depression? And the answer is no. The far more likely scenario is that there is a conflating factor here, where something that is making them both depressed is also making them resistant to these sorts of situations, or perhaps it is depression itself that is making them resistant. So I think that, you know, this is fascinating. I think we're one of the first ones to do any analysis on the mental health of vaccinated against an unvaccinated population, and it does line up with what we're seeing with COVID-19 guideline adherence as well. But I'm sure there's questions on that, so I'll get to the end. Leslie, I know you looked at this too, and we looked at this, and I haven't asked you any questions yet. Is there anything on this or anything previous you want to comment on before we move on?
The one thing, and I'm sort of going back a little bit, way back, but when we were talking, what I thought was interesting about this slide versus the slide about people being worried about themselves or their family catching, contracting COVID-19, and that hasn't eased up yet. So I think I'm really interested to see this in the next one. You know, as people are getting more vaccinated, and I think this is a great finding and great news. And it's also great news about the vaccinated population feeling less depressed. I'm hoping that that will continue on as more people are getting vaccinated, and as the younger people are getting vaccinated, which we'll see in our next poll, as we're getting younger people vaccinated. But it's also going to be interesting to me to see, is there going to be a part where people are now becoming less anxious about themselves or their family contracting COVID? So we'll see where that ends up as well.
Sure. And I see we have a chat. What's the question? Yes, I do agree, Andrea. Very interesting. And I think that's a very valid question you're asking. This is a question of behavioral science, which is actually a deep passion and fascination for me, and but not something that we can really dive into at this point. Anxiety of contracting COVID and the vaccine hesitancy. Of that, I'm curious if you were able to look at the variables of anxiety and contracting COVID, a contributor to anxiety, depression, versus vaccine hesitancy in the relationship. So the vaccine hesitancy question, we're just starting to get enough. It really depends on what you also want to mean around vaccine hesitancy, because there's the group of individuals that are completely not going to get the vaccine. And we want to get a big enough sample, because in each poll, that's anywhere from 6 to 9%. And remember, it's 9% in this of just the non-vaccinated population. So it's not actually 9% of the entire population. So we want to get a big sample before we start doing an analysis. And ultimately, we're going to look at that group that is completely opposed to vaccinations. And then also look at that next tier up of people who are resistant but persuadable, and try and do some analysis on that. But we want to get some good size sample on those things, especially now that the vaccine's wholly available to most people. But yeah, no, we'll make a note of that and reach out to us, and we can let you know if we have anything else. I'm going to move on, and we'll take more questions at the end. Life in the post-pandemic world. I'm now working. So we asked people whether they're working from home or how their life's going to change after the pandemic. Certainly, this is more of a filter we use to try and look at different situations, and we're working with workplace strategies for mental health, Canada Life, to do some deeper analysis on the workplace side, as well as IBM. Are Are you concerned about the continuing potential threat of COVID-19? Yeah, again, 71% of Canadians are still significantly concerned about COVID-19 on an ongoing basis. We just started pushing through some open-ended questions today, and certainly the commentary about the variants was all over the open-ended around what people are continuing to be concerned about as the mutating virus. How that impacts their mental health, though, we haven't got it that far in our analysis yet. I'm just going to take that moment to say that this is an ongoing project. We put out the public report, but we don't stop analyzing it. So we have multiple people who are analyzing this as we go along. The questions you fire to us today will help us illustrate what needs to be pulled out of this. So if you have questions, by all means, put them out there. We have analysts who are looking deeper into this as we speak. And a few of them are on this call. So I'm happy to work with them and happy to keep looking into things like workplace and a number of the other factors. Just cognizant of time, this is the 11% of individuals who access support before COVID, the 1 year before COVID, against the 18% who access support during COVID. This slide looks a little bit different than previous reports because we were looking at the whole of anyone who would use supports in their lifetime prior to COVID. And we've now tightened it to just 1 year before COVID. So the numbers don't line up quite the same, but you can see that access to service went up, and also online went up dramatically. We do see one-to-one went down as well. Family doctors, which has remained steady since then. But yeah, this is a fascinating slide for me. Were you satisfied with your support? If you got that support prior to COVID, 79% said they were satisfied. And if they weren't accessing support, but they felt they needed it before COVID, this is why they didn't access it. Are you satisfied with your support since COVID? That hasn't really moved at all. And the reasons people were not accessing services, the number one was remain the same. You want to manage it yourself. COVID exposure potential was 31%, but I do want to note that you couldn't afford to pay, which was 37% in before COVID, has gone down to 16% post COVID. And then this is all of our names, which is great. So I'm just going to stop sharing here. And I'm cognizant we've got about 5 minutes. I can go a few minutes over, but if you have questions, now would be a great time to fire them to us.
Michael, I'm seeing one in the Q&A section. I think you might have just brought up.
Daily news are having a huge negative impact on the mental health of Canadians. Is MHRC planning to deliver this information to the major news sources? And are there any specific action items related to this finding? The answer to that question is we do share this with all the major media outlets. Whether or not it drives any impact, we don't have that control. But we are certainly making them aware of this. And we do also have channels through social media that we do try and get this sort of messaging out. And this is certainly something that I think we could be looking at for our social media platforms as well. Okay, next question. Thank you. I really enjoyed seeing you measured and observed the results. Is there any important limitations about the self-report mental health scales relationship to particular? Yeah. So again, the reason we went with a self-rated scale, we have a lot of questions about the use of clinical screeners during a crisis scenario. A lot of those screeners aren't validated to be used during a crisis. And so there is no really accepted methodology for properly assessing people using how we're doing it, which is an online panel during a crisis. So there are multiple issues. So we decided, for the sake of simplicity, to have a consistent self-rated scale through the entire project. And then we determined that we would be adding tests as they were validated to be used during a crisis scenario, which is why we've added and tried different tests and take a look at the correlative analysis to it. There is, of course, a bias with self-rated scales, but there's a bias with clinical screeners. There's a bias with all of them. And we do know we're underrepresenting in critical areas, notably Indigenous. We're not getting enough sample, and we're not getting enough sample as well from people with physical disabilities. And again, the small percentage of people who don't have access to the internet is also something we know we're getting biases from. So we are aware of all these biases, and we do try and address them as best we can. It's not a perfect science, but we do whatever we can to try and address those. And we do look at these different tests and correlations between them. I personally am a big fan of the Kessler Psychological Distress Scale. We have also used the Inter-RAI, which looks at sort of some additional making ends meet questions as well. And we we sort of switch in and out tests to see how they're working against those scales as we go. Any other questions? Most people I know are hesitant, but they will get vaccinated at some point. They are mostly racialized and not always have good experience in medical. I would love to learn more from them. So, you know, what's fascinating is we do actually have in our data visible minority status, which includes the broad category of are you a visible minority, but also then further breaks it down. The challenge we have is we weren't getting enough sample up until recently to break it down into the really small communities that we wanted to actually analyze. So as we go forward and we keep getting that data set, we'll be able to look at vaccine hesitancy by demographic group, which is sort of a corollary that we're doing. I mean, we're really trying to focus on the mental health, but we'll be able to get some of that data out there as well too. All right, I'm open for more questions. I was curious, sector. Apologies for joining late. I'm curious about sector specific impact. Oh, you mean, yes, so there is absolutely data by sector specific. I think we have like 26 or 27 different employment categories, as well as full-time, part-time, student, retiree, et cetera, et cetera. Our challenge is when we break it down that much, our sample becomes small. So we really wanted to get a long runway of data. I think now we're over 16,000 data points. So we are working to get an analysis done by different sectors. We're looking at retail, hospitality, delivery services, frontline healthcare workers, secondary healthcare workers, government, et cetera, et cetera. And what we're trying to do is also footprint them so we can show what those sectors look like pre-pandemic to post-pandemic. So stay tuned on that. I'm getting very close to releasing a report, Nina, and I'm very proud of it. It is really, really hard work, but we're working very diligently to do the most comprehensive analysis on workplace. And we are doing a massive data collection on workplace once the people start returning to the office as well, of about 6,000 Canadians likely in the fall. So would you consider adding sense of belonging scale scoring? Jessica, fire us that test you'd be thinking about, the wording on that. We'll take a look at it. We have an internal working group that analyzes those questions. And I think it's certainly worth something that we would absolutely consider, but fire us an email. Milena, young Canadians are disproportionately affected with anxiety, depression. So is there more research looking into how educational institutions, corporations, healthcare organizations, and families are addressing this crisis? I'm not aware. So I know there have been multiple conferences on this. I know that CIHR has done some funding of research around this. I don't know of anything that comprehensively says how we're going to be dealing with this. At this point, I can assure you that this data has been presented to educational institutions, corporations, healthcare organizations, governments, but I don't know. I don't know the answer to that. We're looking at the scale of the issue, not so much on addressing it, which I mean is something that we certainly care about. We just don't have it right here. Okay, more questions. Thank you, Wayne. Okay. Carol, so yeah, again, we're now over in time. My email is mcooper@mhrc.ca. Brittany is bsaab@mhrc.ca. Fire us any additional questions. We've recorded this webinar, so we'll make it available post this if anyone wants to go back and check it out. The report is available on our website, as is the interactive data. Leslie, anything you want to add?
I think it's great. I'm really looking forward to the next poll as we're moving forward. I think we're going to get some really interesting findings.
Great. And a reminder that if you are a researcher, we are turning this data, the raw data, over to the research community. So you can reach out to Brittany or myself, and we can hook you up with the data sets, which allow for a deeper dive analysis if you have SPSS or data capacity in your research. So yeah, thank you for your time. And again, mcooper@mhrc.ca. Or bsab@mhrc.ca if you have further questions. Thank you, Leslie. Always a pleasure working with you. Brittany, always a pleasure. And thanks everyone for joining.
Thank you.